Yeah, we are now on Facebook as well.
Bittu, please go ahead.
All right, we're now at 5:30, so we'll begin. I'm hoping everyone has tuned in on time. Thank you for joining us for the Indian Scientist Response to COVID Groups talk by Professor Ashwini Deshpande. ISRC has felt that a lot of our approaches, that a lot of the scientific community's approaches to understanding, really what policy one should advocate around the COVID virus should not be based on concerns around the virus alone, but really understand from professionals the ways in which this virus has affected the economy, because policy decisions really need to balance what is known scientifically about the virus and the ways in which policy response to the virus can affect the economy. So thank you, Ashwini, for joining us today. Ashwini, I'm sure most of you already know of Ashwini's work. Ashwini is an Indian economist who's best known for papers on various topics such as poverty, inequality, gender discrimination, and regional disparities. She's currently a professor at Ashoka University, and she has taught at Delhi School of Economics prior to joining Ashoka. And she's won many, many awards for her work and for her papers, one of which is called Grammar of Caste, Economic Discrimination in Contemporary India. Thank you so much, Ashwini, for joining us, and take it away. Just a quick question, sort of note to everybody who's listening. If you're joining us on Facebook Live, you can post questions there. If you're joining us on Zoom, you can post questions there. And at the end, we'll be compiling these questions and asking them to Professor Deshpande. So, we'll bear in mind that we'll take these up at the end, and Ashwini, you can decide whether you want to take them up in grouped sort of questions according to theme, or whether you just like to take them on one by one in the order in which they arrive. We will come to that after your talk, so please take it away.
Thank you very much, Bittu, for the very kind introduction. And thank you to the scientist group for inviting me to speak. It's a real honor, and I'm delighted to be here today. This paper is one of the two papers I've written about the impact of the COVID-19 pandemic and the first month of the lockdown on gender and caste disparities in India. Today, I'm going to present the results from the gender disparities paper. Because as Bittu said, the disease is what it is. And of course, there are scientific issues related to the virus and about the medical side of it. But the pandemic and the lockdown has had very serious impacts on economies. And so when we think of the pandemic control measures, we also have to take into account the economic impact. And what I'm arguing through my work is that the economic impact of the pandemic and the lockdown is not neutral vis-a-vis social identity. So even though it's a gender blind lockdown, which is that it's supposed to affect everybody equally, there are no different rules for different social groups. But in fact, the impact on different social groups ends up being different. And when we think of policy prescriptions to the pandemic, we have to take that into account. So that's the broad idea behind this work. Now, the Indian lockdown that happened, and I'm talking now about the month of March and April, was amongst the most stringent in the world. Already by the 25th of March, the Stringency Index, which was developed by the University of Oxford, had reached the number 100, which is the maximum stringency that's possible. Just to just to sort of point out that 100 need not have been the stringency index. We could have had a less stringent lockdown, but that didn't happen. And what that meant was that barring essential services, pretty much everything else in the economy shut down, as we remember. Now, how did this affect jobs? And more importantly, what were the gendered impacts of this lockdown? Globally, women are more vulnerable to losing their jobs compared to men. So if you look at figures that are coming in from different parts of the world, it seems like in absolute terms, more women have either lost jobs or are more vulnerable to losing jobs than men. So in absolute numbers, more women are going to lose jobs. So for example, there was an estimate from the Citibank very early on, which said that out of the 44 million workers in vulnerable sectors globally, 31 million women face potential job cuts compared to 13 million men. Um, so I tried to look at this picture from the Indian perspective, and the only data that we have for the lockdown is released by a private data provider called Center for Monitoring Indian Economy. My university, Ashoka, we subscribe to it, so I was able to use the unit level data, which is a survey data of households and individuals, which are used for these estimates. So sorry about the typo, this should be 2020. So basically this data set has data at the national level from January 2016 to April 2020. So it's continuing, but the one that's in the public domain is till April 2020. Now, this is a panel of households, which means that the selected household is surveyed 3 times per year, and all members of that household are surveyed 3 times per year. So you have in this data set observations or information about every individual in the data set 3 times a year over all of these years. And the data covers roughly 43,600 households per month. That's just to give you an idea of the size, which is a very big data set. So what is the big picture here? So obviously we know that in April 2020, which is the first month of the lockdown, there were huge rise in unemployment, or there was a sharp drop in employment. But you could argue that, well, maybe this is just a seasonal effect. Maybe every year in April there's a drop. Maybe this time the drop just happened to be larger. So to check for that, what I first did was that all the way from when the data was available, from January 2016 to April 2020, I plotted monthly employment and unemployment rates using the CMI data, and so separately for rural and urban. And so if you look at the top two lines, which is the red line is the rural employment rate, and the blue line is the urban employment rate, and the bottom are the unemployment rates. You see that there are, of course, monthly fluctuations, but by and large, there are no huge fluctuations between January 2016 and March 2020. So the drop that you see in April 2020 is not a regular feature that happens every year in April. So definitely the lockdown was responsible for the huge loss of jobs that we saw in April 2020. So for example, so just to look at the numbers, average number of employed people in the previous year, because remember that a lot of work in India is informal, and the employment status of individuals is often not fixed. Or in other words, the individuals for whom employment status is fixed, such as me, for example, are a very small proportion of the labor force. Most of the labor force in India works in informal sectors. So you could be employed in 1 month and you may not be employed the next time you're surveyed. So people keep moving in and out of employment several times in the year, often. So so instead of comparing the April 2020 figures just to March, which is the previous month, what I did was I looked at the average number of employed persons between March 2019 and March 2020, which is 1 year before the lockdown. And that's about 403 million, little over 403 million. This number in April 2020 came down to 282 million. So that's a 30% drop. And this drop was higher in urban areas compared to rural, which is not surprising because the immediate shutdown of the economy affected the urban areas more. So that's just the first broad picture about the job losses. Okay. Now, when we think of the question of who lost more jobs, was it men or was it women? And remember that I mentioned, and there are other figures in my paper, which I haven't put in the slides, which show everywhere that in absolute numbers, more women are losing employment than men. Now, to assess this question in the Indian context, we have to keep certain features of the Indian labor market in mind. So, one of those features is that labor force participation rates of women are low and have been falling in the last 2 decades. So, there are already pre existing gender gaps in labor force participation rates in India. Why that has happened, I've written about that elsewhere, and I can take that up in questions and answers. But what we need to remember is that for this reason, when you look at the people with, the absolute number of men with jobs and the absolute number of women with jobs, then the absolute number of men with jobs is higher than the absolute number of women with jobs. And when you look at the job losses, remember that drop from March 2020 to April 2020, then the absolute number of job losses is higher for men than it has been for women. But what I'm arguing is that in order to look at relative job losses, keeping in mind the pre-existing gaps in the labor force participation rates, what one simple way to do that without getting into any econometrics is that you take the April 2020 absolute number employment and take that as a proportion of the average employment over the previous year, which is March 2019 to March 2020. Simple ratio. And when you plot that for different communities, then you see here, this line here, this bar here for all. This is for the entire sample. The bar to the left of all is for men, and the second right bar the second bar from the right is for women. So you see that in relative terms, women were lost jobs more compared to men. And you can break that up by rural urban, you can break that up by caste. So this is rural upper caste, this is rural scheduled caste, this is urban upper caste, this is just all scheduled caste, etc., etc. You can make these calculations, and then you see this gradation in terms of which was the most advantaged group, which was the rural upper caste, and the most disadvantaged group in terms of job losses, which so rural women. And in my paper, I also have the intersection of caste and gender, but I'm not showing that right now for lack of time. But basically, one way to look at the relative job losses in April 2020 is to look at the ratios. But of course, I've done more than that. And what is good about this data set is that it's longitudinal data, which is that it's data on the same set of individuals over time. So I can actually construct a panel which controls for individual characteristics pre and post pandemic. So I can, of course, only look at one period in time, which is that I look at all the individuals who were surveyed in April 2020, which is the wave 19 of this data set. This covers January to April 2020. And as I said, every month, about 43,000 or so households get surveyed. And I can identify households that were surveyed in April 2020, which is the only month for which I have data post lockdown. And then using the panel dimension, I can identify the same households before the pandemic. So I can just look at just the previous time period when the same individuals were surveyed, which is in December 2019. So they were surveyed in wave 18 in December 2019. So I can just do a 2-period comparison, but I can also do a longer comparison just to make sure that I'm not catching any seasonal entry and exit into employment, right? And so what I did in this was I looked at 4 waves, wave 16 to 19. So basically, for the same set of individuals who were interviewed in April 2020, I have data for April 2019, August 2019, December 2019, and April 2020. So in a way, I can control for their pre-lockdown, the employment situation, just to make sure that if there's something that's causing frequent entry and exit from employment, I'm accounting for that when I look at the job losses in April 2020. So that's what I did in my data set. And here's a picture of what that looks like just over the 4 rounds. So these are the 4 time periods. This is female, male, and these are the proportions of employed, unemployed, and out of the labor force. Now, unemployed in economics is a term to describe individuals who were not working but are willing to work. So that's how, so that means you're involuntarily unemployed. You could be not working, but not willing to work either. In that situation, situation, you're described as out of the labor force, OLF, right? So unemployed are defined as those individuals who are not currently working, but would like to work, are willing to work, right? And so if you see here, first of all, look at the blue dots, because the blue dots are the proportions of employed. And you see already in every month, this is, say, for example, in April 2019, this is the proportion of women who were employed. This is the proportion of men who were employed. August 2019, same women, because it's a panel. Remember, it's the same set of individuals. So there hasn't been much change. So basically, those women who were employed in April 2019, more or less, this is slightly different, but not significantly. So more or less continue to be employed all the way till December 2019. But in April 2020, you see a drop here. Similarly, for men, you see that for the previous 3 time periods, there was no change virtually, but there's a huge change in April 2020. And if you see the change from December 2019 to April 2020 for men, it's in absolute terms, it's of a higher magnitude than it is for women. So that is the point that I was making earlier, which is that in absolute terms, more men have lost employment than women, but it's a feature of just this large gap in employment. So this is just summary statistics, trends and employment rates. Now you can go further and you can control for a bunch of things to say, okay, once we take away the effect of some of the factors, are we still going to find a gender difference? Maybe there isn't a gender difference. What you're seeing here is picking up some other locational factors or whatever, individual characteristics, etc. So I ran this simple equation. I can explain that later. But basically, here is beta 3, which is an interaction between gender and month. And I have individual fixed effects. So whatever the characteristics of individuals that have not changed over the 4 time periods, all those are being controlled for. In other words, the effect of individual specific factors that have not changed has been taken away. And so you then find the effect of only gender and whether there's a differential effect of gender by month. Okay, so that's the basic equation. And then I did some variations of this equation. So for example, in the explanatory, this is a binary variable which takes a value 1 if the individual is employed and takes a value 0 if that individual is unemployed or out of labor force. So you're just looking at the probability of being employed. That's it. Relative to not being employed. It doesn't mean relative to being unemployed. It just means employment takes a value 0. Gender again is a binary here because that's how the data are available only in terms of male and female. This is month, which has 4 values, but one of them will be taken as the base. And this is the interaction of gender and month. So these are all categorical variables. And then there's individual fixed effects. This is the error term. What are the variations I did on this equation? One is that you can add here in the explanatory variables lagged employment. So you can control for whether the individual was employed in the previous period. Now, once you do that, of course, you lose 1 time period because then you're working with 3 time periods as opposed to 4. Okay. And there, of course, individual fixed effects don't make much sense because they'll get cancelled. So I added fixed effects for districts, which means that all the characteristics of the district in which the individual resided have been taken away. You can also, this has, 4 months, 1 month as the base and 3 months relative to that month. I also did, just to check for robustness, I looked at a 2-period panel, which is just look at December 2019 and April 2020. Again, looked at district fixed effects. I also did one more variation because even though the lockdown was equally strict everywhere, the incidence of the disease was not equally strict. So that my thinking was that maybe the fact that some states had a higher incidence of the disease of COVID made them enforce the lockdown more strictly or something. So just to get that effect as well. So I looked at the top 8 states in April 2020 and classified them as high COVID states and the remaining as not high COVID states. So again, it's a binary. And I checked whether in high COVID states, there was a fall in employment over and above the fall that was caused by the lockdown. So did they suffer even more in terms of employment? And, this is too many dots, but I'll just take you through some of the important dots. And in the paper, the whole table with the precise estimates is given. I thought I'll just show a picture because it's in a way easier. So of course, if you see male, which is just the male dummy, then men are just more likely to be employed than women. So this is just capturing that point. And I took December 2019 as the base month. So all the remaining 3 months are relative to December 2019. So you see here, April and August relative to December lie on the zero line. So the estimates are not significantly different from April. But if you look at April 2020, the blue line here, because the blue line is all from single equation, you see that April 2020 employment was significantly lower than December 2019. Now, you interact gender with month. Again, with April 2019 interacted with month, no change. But April 2020 interacted with month, with male, you see a drop. And what this is showing is that in April 2020, more men lost employment relative to women, which is the point I had made earlier. So now, even after controlling for various characteristics, you do find that effect. However, when you put a specification with were you employed previously before the lockdown, okay, and here you now have the red dot, which is controlling for previous employment, and you have the orange dot, which is controlling for high COVID states. In both of those, if you were employed before the lockdown and you were male, this is an interaction of pre-employment and male, you were more likely to be employed post lockdown. So reverse it. It means that conditional on being employed before the lockdown, women lost more. Women were, in fact, in the paper I've calculated the actual magnitude of the loss. So women were 20 percentage points less likely to be employed after the lockdown, conditional on being previously employed. So what this estimate is showing you is just in absolute numbers, men lost more jobs. What these two estimates are showing you is that conditional on being previously employed, men were more likely to retain their jobs, or women were less likely to retain their jobs. Okay. And right, again here, for some reason, yeah, here again you see the same thing. The green estimates are for just the 2-period panel estimates. Again, male into a lockdown, you see the same estimate here. But again, relative, if you just control for a pre-employment, somehow the interaction is not showing up, but it's very similar. Controlling for pre-employment, you see that men were more likely to be employed post-lockdown if they were employed pre-lockdown. Now, what were the kinds of people who lost jobs? What is the profile of job losses? So again, this is just the month. Here, basically what it's showing is that it's the secondary, what the economists call the secondary sector, manufacturing, construction, processing, that people working in that sector were more likely to lose their jobs relative to agriculture. I've taken agriculture as the base. All of this is relative to a base category. I divided workers between 15 to 35 years and 35 and 36 and above. In general, older individuals are more likely to be employed, but older individuals lost jobs relatively more in April 2020 here. And again, I also made two sort of broad categories: individuals with less than class 12 years of education, individuals with more than 12 years of education, just as a very rough cut of more educated and less educated people. And you find here that it was the less educated people that were relatively more vulnerable, had a lower probability of keeping their jobs, or a higher probability of losing their jobs. All of this confirms accounts that we've seen in the journalistic write-ups, which is that it's urban daily wages and factory workers who were employed in small scale manufacturing, processing, services, etc. Those were the people that lost jobs relatively more relative to agriculture. Now, this data set, interestingly, also has information about hours spent on domestic work. Now, this could mean anything, and I accept that, but it's still some little bit of an interesting feature, because the reason that I examined this was India has South Asia, and within that, India and Pakistan have amongst the most unequal divisions of labor in terms of domestic work. So depending on which data, there isn't a whole lot of data, but there is some. And so depending on which data set you use, women put in between 9 to 6 times as much, as many hours on housework compared to men. And this means everything: cooking, cleaning, washing dishes, taking care of the children, doing the laundry, doing groceries, buying vegetables, all of these things put together. And so if you see here, and of course, you know that in India, the lockdown was so strict that the work that gets typically outsourced, which middle class Indians do, which is that they employ help to help them with domestic work. In a lot of cases, if the help was not already staying in the homes of their employers, they could not come to work, right? And so, in general, for everyone, hours spent on domestic work went up. And so the data has the hours in half hourly intervals. So I just plotted the half hours. And you see here the December 2019 distribution for women. This is April 2020 distribution for women. This is the December 2019 distribution for men, April 2020 distribution for men. And you see, of course, that for both men and women, the height of the proportions that do more work has gone up. So there's been some shift in the distribution. Remember, it's only 1 month. It's only April, which was a very strict lockdown. And so I'm not making any claims for any elastic change or anything. And then when I estimated this running a regression, I find actually that, no, I don't have the tables here. Sorry. I don't have the tables, but the tables are in the paper, but I'll describe the results. So basically, when I run the regressions, several things come out. One is that the gender gap in hours spent on domestic work decreased in April 2020. It's possible it was just a one shot wonder. Maybe it's not a green shoot of anything, but it's something to be noted. And the proportions of men doing between half an hour to 4 hours of work increased in April 2020. So that's one thing. Who were the men that drove this change? These were the men who lost jobs in April 2020. So I have another regression where I check for men who were employed in April 2020 versus men who were not employed in April 2020, and the bulk of this is being driven by men who became unemployed in April 2020. I also checked for whether staying in nuclear or extended families made a difference. So overall, women do more housework in nuclear families than in extended, but there was no differential change in this between December and April, right? So relatively, they didn't shift. So the distributions for December and April look pretty similar so there is a difference between extended and nuclear, but that distribution did not shift in April. And the fourth point that I checked was about time spent with friends, because this lockdown has been extremely stressful, and time spent away from family is often a stress buster. It just helps you to unwind, to sometimes vent, or if you're tired or exhausted or having issues with the family, etc. And in fact, for both men and women, the hours spent with friends went down in April relative to December. But again, relatively speaking, the hours spent with friends went down more for women than for men. So again, the women bore the brunt of this sort of isolation in some sense. Again, don't read too much into it. It's just data for 1 month, and I'm waiting for more data to be released to check whether these trends are sustainable or not. And the final point I'll make is about women who still have, who are working, who have jobs. Now, the frontline health workers in India are almost exclusively women. And by that, I mean the ASHA workers, the Anganwadi, the ANMs, the auxiliary nurses and midwives, and the Anganwadi workers, the ICDS, Integrated Child Development Scheme workers, who have been deployed in the COVID fight extensively. Now, these women, all of these three cadres are made up exclusively of women. These women are poorly paid, at a very high risk of getting infected, with very little protective gear, ostracized, and targets of stigma and violence. And there's plenty of evidence on all of these counts. You can just Google and check for yourselves. So these are soldiers in this fight against COVID. And they are women, which is great, but they are, so it seems to me like the choice is that either you lose your job or you're in these extremely risky, hazardous, and stigmatizing occupations. I also looked at some micro, small, and medium enterprises data, which are sort of entrepreneurs or just very small self-employed individuals, and just looked at registrations, which is not a very meaningful indicator because not the smallest of enterprises don't bother getting themselves registered. But if you, it's again a rough indicator. But if you look at the data for registrations for March to May 2019 and compare that to March to May 2020, so just 1 year apart, in most states, registrations of MSMEs went down, not surprising. In the states where they went down, the percentage decline for women-owned enterprises was greater. In the very few states that the registrations actually went up, the percentage increase for women was smaller. So on the one hand, women were more vulnerable to losing jobs, but that wasn't getting translated into them starting their own work, own business, right? So that's what this shows. And so the livelihood situation for women, which is already bad, given the pre-existing gender gaps and labor force participation rates, have been made worse by the pandemic. And the choice is really for them between risky jobs or unemployment. That's it. So this is my presentation. And I'm happy.
All right. Thank you very much, Ashwini. It was a really great talk. Thank you. I have lots of questions, but I think I'll begin with the questions that people have posted. So the first question is from somebody about the question of sort of the profession of teaching itself. And this person says lecturers and assistant professors of arts and science, particularly from engineering colleges, numerous private colleges, have lost their jobs or salaries were withheld for the past 4 or 5 months. It's so pathetic that people with doctorates from reputed institutions are also in this trap. What will be the future of this profession?
Yeah, very good question. And I share your point exactly. But yeah, I mean, of course, the future is bleak because we need to value education. We need to, and so one of the things I've been making, one of the points I've been making, sort of stepping back from this question, is that India actually, whether Indians living in India or Indians living abroad, India is actually has a huge pool of scientific, scientific minds, and they are willing to work with data. They are willing to analyze. They have huge amounts of expertise, and actually now is the time when all hands need to be on deck, and the government should really engage with the scientific community and open up data sources, involve us in conversations. I'm not saying that any one person has the answers, but collectively, I think we have the expertise that we can provide the answer. So for that, you need to respect scientific personnel. And I don't mean literally just scientists, but just, people who can contribute through their scientific knowledge. So now is the time to open up the data archives, to put all our minds together collectively so that we come up with the multiplicity of solutions.
Mm-hmm. I think I'm sure a lot of people also have questions about sort of, this mode of online examination that has been announced for many colleges. What is your take on that in terms of how it relates to disparities in access to education?
Yeah, I mean, that's not in my paper or anything. I mean, so these are just my sort of layperson's views, I guess. I think that there's a huge problem. If you look at this computer ownership, if you look at internet access in public universities, most students, if they're lucky, they have smartphones. And often there's just one smartphone for the entire family, right? Mm-hmm. So mobile ownership is high in India, but a lot of it is not 3G enabled. It's not internet friendly, right? And so when you think of solutions, you have to keep in mind the context. I mean, what works for Harvard doesn't unfortunately work for a state university in a remote part of India. That's just the reality. And so when we think of solutions, we have to keep the constraints in mind. And so I think it's going to be very, very challenging for most universities to conduct examinations online.
Mhm. Okay, so we have a couple of questions about female labor force participation. Why is the female labor force participation decreasing? Does it vary depending on caste, status, or educational level? And there's another question which is sort of related, which is what explains the pre-existing gender gaps in employment? So perhaps if you could address both together.
Yeah, I mean, that's a long discussion, but let me try to summarize it as briefly as I possibly can. So there are two issues as far as labor force participation is concerned. One is the level and the other is the decline. Okay, let me start with the decline first, because in some sense, it illustrates many of the problems with data that, many of us have been talking about. So when we are measuring labor force participation, the use of the term, that's the right metric to measure, I'm not quarreling with that, but what ends up happening is that a focus on a binary indicator, which is you're in the labor force or you're out of it, which is what labor force participation does. Focus on a binary indicator makes it sound like women today are not in the labor force, whereas they were in the labor force yesterday or in the previous period. That's what explains the decline. And it somehow makes the story about the willingness of women to work. And therefore, you have a huge amount of literature from sociology, from economics, that focuses on the unwillingness of women to work in paid jobs. So it focuses on sexual violence, it focuses on stigma of work, it focuses on all of these factors. And the story that is in, and this is by the way, the majority of the workforce, what economists call the supply side reasons, which is reasons that affect women's labor supply. I'm in a minority with several other very illustrious people who some of us are arguing it's not a supply side story, it's a demand side story, which means that the demand for female labor, the nature of technological change has been such, the nature of job creation has been such that the demand for particular types of female labor has gone down, and the availability of jobs is not in sync with women's educational capabilities. So one of the things that's happened precisely during the period when the female labor force participation rate has gone down has been a tremendous increase in women's education levels. Now, women are today definitely studying up to class 10, often up to class 12. That's par for the course. The older problem of women dropping out at class 4, etc. It happens, but it's not the bigger problem today. Now, once women are educated up to class 10 or class 12, then you need to have jobs in rural areas that are commensurate with the level of education that they have, which so the skill mismatch that the government keeps talking about, the skill mismatch is not happening from the side of the labor suppliers, which is the workers. The skill mismatch is happening from the side of the people who demand labor. So where rural job creation is in crisis. The few non-agricultural jobs that are getting created in rural areas, some of them are this Asha Anganwadi, but barring that, most jobs employ men. And women, once they've studied up to class 10 or class 12, NREGS work, which is just breaking stones, they don't want to, because their aspirations have been raised. They've studied. And so a lot of the times they will actually prefer not to work, or they keep looking for work. Right now, all that gets reflected in lower labor force participation, but it's not because they don't want to work. And in the focus on labor force participation makes it sound like women are dropping out because they don't want to work. That's one part. The other is the way in which work is counted. You have to either be working for the majority time in the previous year, or you have to have worked for a period of 30 days in the previous year. Now, what if I am a worker in a village, and earlier I could get work for 30 days, let's say. Now I get a construction job for 10 days, and that's it. So at no point in the year, so I've worked for many 10-day periods, but at no point in the year have I worked for 30 days at a stretch. So my work has become more fractured. I'm the same person, but now I will register as a non-worker in the statistics. So the nature of job
Right.
creation and job availability has changed. And it's a little bit technical, but you have to go into that and understand that a lot of this decline is an artifact of the way in which data are collected. So, I mean, I have some solutions. Many of us have been putting our minds to it and having solutions about how do you capture women workers. And so that's one. The other is the low level, right? Now, the low level is true. It is true that internationally speaking, the low level has been there for 30, 40 years. And there, in fact, this unequal gender division of labor inside the household plays a huge role in explaining the low level. So one is the availability of jobs. The other is women, even today, even in the most educated families, are seen as predominantly responsible for housework. Even if they employ paid help, it's they have who has to get the housework done. So even if you're rich enough to employ paid help, but it's your job to get it done, which means that if the maid doesn't come, you take leave, etc., etc. Child care, doing elderly care, all of these factors are exclusively seen as the woman's domain. So the gendered division of labor within the household is extremely unequal in India and Pakistan. And that's what explains the low levels of female labor force participation in this part of the world relative to the rest of the world. So I think that it's a very large question. And I have been working on this last 2 years, but I think we need to look at the low level and the decline a little bit differently. The decline has nothing to do with sexual violence. I mean, there is absolutely, I've looked at the data. There is nothing that shows that a rise in sexual violence is responsible for the decline, right? In fact, there's a huge unmet demand for work. So when you ask women in surveys, if work was available either in your home or near your home, would you do it? There's an overwhelming majority of women that say we want to. It's just that work is not available. So what do you do then? You just drop out of the labor force. So,
okay, lots more questions. There is one on the economic costs of the suspension of the midday meal program due to school closure.
Yeah, that's a huge issue. And in fact, in Africa, in the earlier epidemics, Ebola, H1N1, etc., there's a lot of evidence to show that school closure has many disastrous consequences. One of them being that often the meal that children get in school is the only decent meal they get in the entire day. And so that again, if the government could have had the foresight to take care of it. I mean, if schools are closed, you can still supply midday meals to the homes. And many of us have been arguing that, that you should supply in villages. It's not difficult to supply midday meals. That will generate employment for the providers of midday meals, and it'll give the children one good, decent quality meal. I won't say good, it varies, but decent quality meal to the children. So the effects of midday meals on cognitive abilities, on children's ability to focus in schools, etc., have been shown in papers. So the lack of this meal, coupled with possible unemployment of their parents, spells disaster in terms of the already malnourished Indian children. India is home to the largest proportion of stunted children. So that's childhood malnourishment is very rampant in India. And now you add to that, months of extra malnourishment, and that doesn't bode well at all.
So to add to a previous question on whether female labor force participation varied depending on caste and status and educational level, I wanted to ask about the data that you showed as well, where you showed various categories, and it looked like the categories for men aggregated, but there was a single sort of female category. So if you break up the loss of jobs from among women, say depending on caste or status, do you see any differences in terms of which demographic among women has lost jobs the most?
Well, actually, I mean, I'll go back to those results, but the thing is that the more categories I break into, I lose power because
that's right.
The number of observation becomes small.
Right.
That's one of the issues. And so in the published version, the paper that's up in public, it's really just aggregate men and women, but I'm going to see at least some categories of women where I have enough observations, and men, I'll compare that. But again, I have another paper that looks at Dalits versus Adivasis versus upper caste, and you see Dalits and Adivasis have lost twice as much as upper castes, and this is controlling for, so even when you look at everybody with more than 12 years of education, everybody with less than 12 years of education, so it's again not a function of whether you are more or less educated, it's the caste effect. So it's caste effect over and above education and all of that. So that's many results. So I broke it up into two papers. Originally it was one paper, but I've now have two papers. So yeah, another, I can share that with you a bit too later when
One
there's
person also has a question about the stringency index and how it's
I was just
calculated.
watching that. So the Oxford School of Government, the Blavatnik School of Government in Oxford, they have been collecting data across the world, and if you just Google the School of Government or Governance, you will come. So they have a stringency tracker. And when you go to that website, you put in your country and you put in the date, and it shows you. So basically, it's they just look at what were the facilities that are shut, and they use that to classify countries into stringency indices. So it could be from 0 to 100, which means 0 means normally functioning, everything is open. 100 is everything is shut, and India was already at 100 on March 25th, which is literally one day into the lockdown. So India started with this massive um, stringency. There's one question I do want to answer, which is about government announcements.
That's right.
From
What have
the,
been the policy consequences?
yeah.
Yeah.
So here, again, it's a long discussion, and I don't want to inflict myself too much on you. But to summarize it again, the thing is that when production is down, when production is shut down, right? How do you get employers to start production again, start their enterprises again, production or service, whatever it is? They will do it if they feel that there are going to be customers, if people are going to buy their produce or their services. If there's going to be uncertainty about the sale of the output, whether it's goods or whether it's services, why would any employer restart their business? Okay. Now, given that the pandemic is coming and going, it's becoming, Bangalore and Chennai have already reintroduced lockdowns. Tomorrow they might scale back, but again, they might reintroduce, etc. So, given the fact that we don't have a vaccine or a cure yet, there is a lot of uncertainty about the economic situation,
Right.
the prevailing economic situation. Also, the way in which lockdowns have been announced just summarily without giving any warning has meant that the migrant labor that we didn't know, but now we have discovered, is the backbone of our existence, both in terms of providing us domestic services, in terms of helpers and gardeners and drivers and all of these, vegetable sellers, etc., plus providing us labor in our factories and farms, etc., etc. I don't think most Indians had realized just how much dependent we are on the migrant labor. Now, what happened because of the sudden lockdown and the fact that factories shut down overnight with no guarantee about when they'll reopen, and the workers had no guarantee about whether they're going to get any income at all or not. So we saw these horrific scenes of migrant workers trekking, miles and kilometers going back to their villages. Now, with that uncertainty, unless the workers are assured that even if there is a lockdown later, you will still get your salary or you will get some cash, combination of cash and kind transfers, workers are not going to be able to come back even if they don't get jobs in the rural areas. So basically, the factories are stuck with no workers and uncertain demand. Okay. Now, what has been the focus of government policies? The focus of government policies is what economists call supply side measures, which means we'll give you loans, we will waive your loans, we will give you 3-month moratorium, we will give you liquidity which will enable you to restart business. But why will I take a loan if I don't know whether my output or my service, A, whether I'm going to have workers to produce, to work in my factory, and B, even if I have workers, why would I take a loan if I don't know whether my product is going to be sold? So many economists have been arguing that the problem today is one of demand for services and products, not of supply. Employers are willing to restart.
Right.
They need to have the confidence. And so it's a combination of many things that needs to be done. One is everybody who needs it must get a combination of cash and in-kind transfers immediately without ration card. Issue everybody temporary ration cards. Don't go into this biometric Aadhaar authentication, etc., etc., etc. Today, if somebody is destitute and they need the cash and they need the transfers, they need to get it. So temporary ration card should be issued to everyone, regardless of where you are, because a migrant worker who has a ration card in Bihar cannot use that to get their rations in Delhi. They can't, right? And so that's one thing. The second thing is neither are in-kind transfers sufficient alone, nor are cash transfers sufficient alone. So both have to be given, and the government has to find a way of delivering this. This is not impossible. The government of Kerala, for example, in India, has shown when you have the will to deliver these relief measures, you can.
Right.
Odisha also has made substantial progress because they employed the panchayats in delivery of services. So when people couldn't go to the bank to access their Jan Dhan accounts or whatever, they actually disbursed cash publicly using the Gram Panchayat officers so that there was no corruption. People are always worried about, oh, we give cash, there'll be corruption. Today is not the time to worry about all of that, right? So when it comes to relief to the poor, I think we need to not get set in those bureaucratic mindsets of Aadhaar card, this thing, that thing. The main thing is to see is how do we get the relief to the people, and many people have done it. So these suggestions that are coming from economists are not in fantasy land. There are examples of how you can deliver along these lines, and unfortunately the package announced by the central government is very weak on the demand side. Most of it is the supply side, liquidity. But there are no takers in banks. I mean, you go to the banks and you ask them, employers are not taking these loans. And why would they? I mean, think about it. If you were already indebted, why would you take a loan and become more indebted if there is no guarantee that your product is going to be sold?
Right. There are a couple more questions that I'm going to ask that haven't, well, okay, so there's one more question that's just shown up, and then maybe I'll go on to other questions that people have generally been asking from among the scientific community around the sort of ask an economist type questions, which I'll ask you.
Right.
So the question from the audience is, has the government shown any inclination towards adopting these suggestions that you just proposed?
So again, the experience of India is very varied. I mean, we tend to equate India only with the center, and to some extent that's valid. I understand that, but I think India is a very diverse country. And what has been amazing about the pandemic is just as there have been very heart-wrenching, gut-wrenching images and stories, there have also been amazingly inspiring accounts done in communities and in states. So I already gave the example of Kerala and Odisha. If you see the slums of Dharavi, everybody had predicted that the Mumbai numbers are going to be fueled by the Dharavi numbers. That because of the very high density of population in Dharavi, that's going to be the super spreader. Well, guess what? It isn't. Dharavi has managed to flatten the curve even when the rest of Mumbai, the curve has been rising. So these preconceptions that we have that it's the poor people, they don't know anything, they just live in these countries. It's actually the rich who have been, so I think that we need to focus a little bit more on the diversity in experiences. And how did it happen in Dharavi? A lot of citizen initiative. There are incredibly brave journalists and volunteers who have been going to Dharavi, have been providing. So why will people go out and look for work if they are getting their basic needs inside the home? I mean, the reason that some of us can say, oh, I'm social distancing is because I really don't have to go out to work if I don't need to, because I can order everything online. I mean, I go out once a week personally just to get out of the house, but otherwise I need not actually do that. But that is because I have a job, I have a salary, I can order everything online. And so the fact that poor people go out is because they have to go out in order to get a livelihood. And in Dharavi, what happened was that there were citizen volunteers who made sure that people were getting hot meals and other needs, dry rations, so that the contact between them, which is just everyday contact to go out and get a meal, was minimized. immediate isolation of those who were detected in within Dharavi. They created these centers. So it's of course it's a mini experiment, but the point being that if you become very proactive and you aggressively contact trace, you minimize the need for people to go out. I mean, some people will break lockdown and they'll go out, but I mean, when I see images today from the United States, honestly, I'm horrified about the anti-mask, sentiment that you're seeing. In India, when most people are going out, they're poor people, they have to. But again, in Dharavi, you see that because citizens stepped up with dry rations, with hot food, with relief measures, people didn't really have to go down. So Dharavi is actually managing to flatten the curve. And it's an amazingly inspiring story. So I think that we should focus on the larger picture, national picture, but we should also take heart from the fact that in the most unexpected places, without a lot of funds, the right approach can actually deliver results.
Yeah. Okay, as the pandemic shows no signs of diminishing, how do we face these issues in the long run?
Well, I mean, there's been episodes in the past in history. There have been wars, there have been pandemics, there have been, um, depressions, etc. The fact is that employers, particularly the smaller employers, it's impossible for them to keep on paying salaries if their work is shut down. So at one level, it's a crisis of everybody. But this is when the state or the government has to step in. I mean, you may have heard of John Maynard Keynes, who became a very important post-depression era economist, who pointed out that there are times when the government has to step in as the employer of last resort, or as a provider of relief. This is not the time to worry about fiscal deficits and so on and so forth, concerns that typically people are worried about, and many other things. So for example, there's Food Corporation of India, which buys food from farmers at a minimum support price. There is excess grain sitting in FCI godowns, literally rotting. I mean, even if that grain was to be given away for free, the government will save money because the FCI costs of just keeping the grain every day is very high, right? And so I think that there is a lot that can be done by the government that steps in as the point that provides a relief to employers and to workers. It has to do it. I mean, there come times in history when we reach, when it's calamity, and we are living through one calamity today. So now is not the time to. It's not business as usual, or we can't think of it as business as usual.
Right. Yeah, I mean, I think another question that people have generally sort of wanted to understand is, as scientists scientists have advocated a lockdown at one point in time, although there's a lot of debate within the scientific community as to when a lockdown is effective, how long a lockdown should last, what other measures should happen while a lockdown is in place, in order for the lockdown to be maximally effective as opposed to just a shutdown. And a lot of the failures of the lockdown are attributed to bad science, but bad implementation. So I'm curious as how you see this. Do you think that there are, economically speaking, things that a government should be doing during a lockdown that could change the way in which a lockdown plays out? Or do you think it's just a question of implementation? Do you think that that government policy was fine and that implementation was badly done in terms of the suddenness with which things were announced, the lack of arrangement of transport, and that kind of thing?
So the funny thing about India, the Indian experience is that, or bizarre thing actually, is that the strictness of the lockdown was the highest when the epidemic was the lowest.
That's right.
It seems a little bit
strange,
bizarre to me. And so at that time, we could have possibly done with a less stringent lockdown to do it, and so, but we wouldn't know how to do it unless we had testing and we knew where the locations were.
Right.
So at that time, if there had been greater attention given to testing and had more localized lockdowns and given people more time to think about it. So we had, one day we could go out and the next day we just couldn't even step out,
That's right.
It was that severe, but the disease was not so, spreading so much. And today, the epidemic is raging, but the lockdown has been lifted. So
Yeah.
it's like getting the worst of both worlds. And so I would say that yes, lockdowns are necessary at some points, but I think that, you know, everything is a human cause. I mean, people are saying lives versus health versus jobs.
Mm-hmm.
I think that it's just lives versus lives, because even if you look at just the health issues, the fact is that because of the very stringent lockdown and because now the spread of the disease, many other non-COVID health interventions are not being sought. So people are not going for their cancer
Right.
treatment. TB's treatment is suffering.
HIV.
Children are not getting their vaccinations. You know, we had eradicated polio. And again, that leads to my early childhood point, which I'd made earlier, which is you need micronutrients from 0 to 5, which the Anganwadi workers provide in villages. And now today, all Anganwadi workers have been deployed in the service of COVID. So I really don't know whether uh, the usual, you know, schedule of vaccinations and micronutrient dosages is being followed. So that's also a health cost, you know. So epidemic is a health cost, but all of this is also health costs. And people dying of starvation is also lives. So it's lives due to COVID, lives due to other health issues, lives due to economic starvation, or mental health issues, you know. Those are soaring as well. So at the end of it, it's all lives, you know, in different forms. And I think that you do need to balance all the considerations. And of course, if a lockdown has to be done, it has to be done. But maybe you can think of how do you make people wear masks more often, or, you know, is there something where limited mobility is allowed, but all of these practices are more strictly followed, or something like that, which is more doable. I don't know. But I think India can't have one model. I think we need localized, localized interventions, and things that will keep going on and up. And in fact, so we had a policy brief from the economics department in Ashoka, and we kept said that for the next 2 years, they are going to be in and out of this situation many times, you know. And so we have to be ready with
That's right.
with but it's not like an on and off switch. It's not like you switch something off
Yeah.
and you switch it on and suddenly business comes back to life. It's not going to happen that way.
That's right.
So I
mean,
think
certainly, yeah, as you say, many of these, there is one of the reasons that we need to work together on some of these questions is because many of these economic measures then have health consequences which deal with how one can biologically face the virus. So, for example, decreased nutrient availability, because most of my working class friends have stopped eating vegetables and they're just eating, sometimes not even protein, sometimes it's just rice, you know, fried rice in various forms. You know, some people are just eating rice and dal and are not eating vegetables. So all of that nutrient availability is going to start affecting their immune systems. And of course, people's just lack of access to health. I know several people who have died because they've not had, you know, access to health facilities. So certainly, you know, those assumptions that scientists work into models, you know, just may not depending on how policy actually plays out.
so you have to bring these, and that's why socioeconomic awareness of the socioeconomic fault lines is essential.
That's right.
All individuals are not. So, you know, men and women, different caste groups, rural, urban, remote areas versus not, you know, non-remote areas, all of these things, like distance to the nearest big town, that's a huge indicator of disparity, you know. So you need to have all of this expertise built into the models as well, you know. And that's why I was saying what I was saying earlier, which is that instead of shutting out the scientific community, the government has to democratize data and has to open up to all of us, you know, because each of us can contribute one tiny bit, but together, I think India has the expertise, you know, so to provide insights into all of these issues.
Right. All right, we've crossed you know, the 1 hour mark, so we should probably wrap up. Thank you so much, Ashwini, for talking to us. For those of you who are listening, you know, the Indian Scientist Response to COVID is a group of you know, hundreds by now scientists who have you know, really spent the last several months since the lockdown began talking, you know, debating, sharing scientific articles so that our expertise is pooled together, and also thinking about the various perspectives that we're missing as a community in terms of how to sort of be helpful really and useful in terms of thinking through the COVID crisis. And so, if anyone's listening and would like to be part of the group, do contact one of us. Thank you all so much for listening. All right, take care, and do keep a lookout for more of our webinars. Thank you once again.
Thanks for having me. Thank you.
Thank you. Thank you very much.